Japan, stroke is the #1 reason people become bedridden. It's also known to leave patients with muscle weakness or paralysis and can cause many other potential problems and complications. To reduce paralysis and regain movement and control of the affected area, rehabilitation is critical. But until recently, the medical field had established that after 6 months, major improvement was virtually impossible. Now, a new method in which the brain is stimulated using this machine is overturning that theory. And thanks to this, it's now a possibility that the effects of a stroke can be improved no matter how much time has elapsed.
Masayoshi Tomono suffered a stroke 1 year ago. His wife found him collapsed in the bath and called for an ambulance. He narrowly escaped death thanks to prompt treatment. But the stroke left the right side of his body partially paralyzed. He has difficulty raising his right arm.
If I simply raise my arm, this is the limit. But if I try really hard, I can raise it this high.
He started rehabilitation immediately after the stroke. But after 6 months, he seemed to see little improvement, no matter how hard he worked. When we try to move one of our hands, the opposite side of the brain fires off signals to move the muscles. The signals travel through several nerves that control hand movements. Strokes damage parts of the nerves, making it impossible to convey the signals to the muscles. This is what causes paralysis. Continued rehabilitation enables sections of the brain near those controlling hand movements to send signals. But once 6 months pass, it becomes difficult to create new networks of nerves. That limits further improvement.
Let's eat.
Tomono is right-handed. His paralysis has made many aspects of daily life difficult.
No way.
He can't extend or bend his fingers properly. That makes it hard to pick up food with chopsticks and move it to his mouth. He can use his left hand, but it's clumsy. Writing is also tricky. Orders from his brain don't travel smoothly to his hand, making it hard to hold a pencil.
Illegible, right?
Tomono used to run a bone-setting clinic where he treated injuries like sprains, but after his stroke, he closed it. He also quit judo, which he'd practiced for 40 years, and started spending more and more time at home.
I had to give up things that I'd always done. At one point, I felt that I'd lost everything. I thought that eventually I'd be able to move my hand more smoothly, but that didn't happen.
Then, he heard about a promising type of treatment offered by a hospital in Tokyo. Masahiro Abo has spent more than 20 years pursuing new ways of treating paralysis. He has been studying brain images of patients taken more than 6 months after they have suffered a stroke.
In stroke paralysis, little improvement occurs 6 months after onset. But our new treatment has been proven to make improvement and recovery possible in mild to moderate cases.
This is a simulation based on MRI images from multiple patients. The left side of the brain has been damaged by a stroke. The area in red becomes active when the person tries to move the paralyzed right hand. Healthy people use just the area shown in yellow to issue signals to move the right hand. In the simulation, the much larger area shown in red becomes active to help make up for the damage. This phenomenon is caused by unnecessary activity in the right side of the brain. This image illustrates the activity in the right side. Experts used to believe that in cases like this, the right side of the brain would assist the damaged left side. But Abo has found that such activity in the right side actually confuses the left. So, he used this piece of equipment to come up with a way to suppress activity in the right side of the brain. When an electric current is applied to the black part, it creates a magnetic field. An eddy current forms underneath, making it possible to send faint electric pulses into the brain. Applying 60 pulses per minute can curb activity in the brain. The procedure is called transcranial magnetic stimulation, or T.M.S. The device was originally made for testing nerve connections between the brain and other parts of the body, such as the hands and legs.
He's receiving magnetic stimulation now. If you look at his hand, it's moving. His hand is twitching because the nerves are being stimulated.
Each section of the brain's surface is responsible for moving certain body parts, such as the face, hands, and legs. Here, Tomono receives T.M.S. in a section of the right side of his brain that was hampering improvement in his paralyzed arm.
I'm administering about 1 pulse per second. It's low-frequency stimulation. This kind of slow-paced stimulation reduces activity in the right brain.
This shows how a person's brain might look after magnetic stimulation. Compared to before, there's less activity in the right side of the brain. There's also a significant reduction in the active areas of the damaged left side. When activity in the right side of the brain decreases, the left side doesn't become confused. Now, it is able to activate only the region involved in hand movements, shown in yellow. T.M.S. requires 2 weeks of hospitalization. Patients undergo 40 minutes of stimulation every day along with rehabilitation. The rehabilitation exercises help loosen stiff muscles and ensure they move properly.
6、8、9.
In rehab for fingertips, patients work to relearn various fine control movements. Continued rehab and magnetic stimulation therapy can help establish new nerve circuits connecting the brain and the hand, allowing patients to regain movement. On Tomono's final day in the hospital, he undergoes a test to measure his improvement over the past 2 weeks. It involves lifting a 640-gram block above shoulder height and placing it on a stand. This is how he did on the same test on the first day. He couldn't move his arm and fingers the way he wanted to, and wasn't able to lift the block. But by the end of his stay,
I did it!
he used to have a hard time writing, but after 2 weeks of treatment, he's able to write letters of equal width in a straight line. Before treatment, he couldn't raise his right arm above his shoulder.
Terrific!
Now, signals from his brain have begun reaching the arm, and he can raise his arm over his head.
I couldn't roll my shoulder like this before. I'm doing this for the first time. It's amazing that I've improved this much in just 2 weeks. I'll show my friends what I can do the next time I see them. It would feel great to impress them. But the best thing is that I think I can make further improvement if I continue to work hard. It gives me hope.
Abo and his team have administered T.M.S. to more than 4,000 stroke patients. Upwards of 90% have shown improvement.
The patient actually was for 2-week treatment after she'd been admitted to hospital. How long will this effect actually last?
Some patients retain function after just 1 course of T.M.S. I can say that the effects last long in patients who work hard on rehab.
So, Rosa, when somebody's actually had the stroke, within how many years do they have to have this treatment, the T.M.S.?
We offer T.M.S. to patients who still have some mobility in the hands. So it doesn't really matter when they suffered a stroke. Our treatment can improve hand mobility, but it's impossible to restore it perfectly.
Are you serious? So it could be 5 years, 10 years, 20 years later?
In the longest instance, we had a patient who had a mild stroke 23 or 24 years earlier, as a child. This person had a little mobility in the hand, but hadn't seen any improvement in many years. We thought it might take time for T.M.S. to have an impact, but the improvement was impressive. The patient was able to pick things up like this.
And Professor, does it work equally as well with paralysis of the legs, or is it just working with the arms?
That's right. T.M.S. is effective for the legs, but it's more like it loosens up stiffened muscles. It enables patients who can walk to walk more smoothly. But T.M.S. can't restore the ability to walk in people who aren't able to.
So there's completely no side effects, no risks at all with the treatment?
There are absolutely no side effects. We've never had a patient quit treatment midway because of pain and so on.
Abo is refining T.M.S. in the hope that it can someday be used for a variety of conditions.
This is 1 pulse per second.
Wow. It's a really bizarre feeling.
Next, I'll change it to 10 pulses per second.
Oh, wow. Oh. Not painful. Wow.
That was 10 pulses per second.
So why would you use the difference? Why would you have this slow one and then why would you have a fast one?
1 pulse per second curbs activity in the section of the brain where the stimulation is applied. But, as you might have noticed, faster pulses stimulate it.
It's so different. I mean, the first one was quite relaxing. The second one is really quite stimulating.
Exactly. Strong pulses boost activity, in the region.
By varying the strength of the pulse and directing it at different areas of the brain, Abo is using T.M.S. for another serious after-effect of strokes. A stroke in the left side of Sosuke Inagaki's brain 7 years ago paralyzed the right side of his body. The stroke also resulted in aphasia, a language impairment. Because of the condition, he could no longer work.
Damage in the speech control center of the brain makes it difficult to speak. Even if you can utter words, it's difficult to speak intelligibly. Patients might also have trouble reading and writing. In Mr. Inagaki's case, he knew what he wanted to say, but he couldn't remember the words. What is this?
In conventional treatment for aphasia, patients work with speech therapists who use aids like pictures to help them retrieve words. This was filmed before Inagaki underwent treatment with Abo. At this time, he'd been undergoing rehabilitation for more than 10 months, but he couldn't explain simple illustrations. This image shows the areas of Inagaki's brain that were active when he was speaking. Most people use the speech section of the brain, circled in blue, but no activity was detected in the damaged side of Inagaki's brain. One section in the opposite side was slightly active.
We believed that we would see some improvement if we enhanced activity in the section of the brain patients used while speaking. Based on that expectation, we developed this new treatment method.
Abo applied fast pulses to the area Inagaki was using for speech to enhance its function. He underwent the treatment during 4 hospital stays over 4 years. He also underwent speech-language therapy. It's been 7 years since his stroke.
Hi, Human Web です。はい、少々お待ちください。植木さん、面接の佐々木さんという人が来てます。はい、ありがとうございます。
Inagaki is now working again. He's gotten a job as an administrative clerk.
名刺のやつをやってたんですけど、あ、どうすればね。どうしたらいいんですか。あ、これ、はい。
He can converse with colleagues without any trouble.
喋る喋らないから言えば喋れるのは一言二言だろうとは思ってました。解放して、まあ企業に勤めれるっていうのは良かったなとは思いますね。
Because I can imagine it must be just such an incredible improvement of quality of life.
There are people who have strokes and suffer damage to their brain at a young age. As rehabilitation doctors, our ultimate goal is for them to be able to return to society. If we can help them get on the path to finding work or figuring out their next move, that really motivates them to keep going.
So what else do you expect that it could be effective for?
T.M.S. can help children with cerebral palsy who have difficulty walking, for example. It's extremely effective if they undergo rehab after having T.M.S. People with Parkinson's disease can also benefit from T.M.S. I believe it's applicable to various diseases.
Well, perhaps be effective for next. But I think it gives so much hope and I think so much promise for patients who have suffered a stroke. So thank you so much.
Arigatou gozaimasu.
And the number of stroke patients is expected to increase. So trying to ameliorate the effects of the condition by targeting the brain could be hugely beneficial. The way transcranial magnetic stimulation works isn't yet completely understood. And there's hope that research will soon uncover the exact mechanism behind it, and that will help it to become more widespread, allowing patients to go through rehabilitation with confidence.
Sometimes, people display subtle signs of a stroke before it strikes. But these signs can be easy to miss. Today, we'll share some tips for spotting a stroke in family members or friends before it's too late. And we'll also point out a few things to be careful about when helping with rehabilitation at home.
How soon after, for example, that somebody's had a stroke, how quickly after are these symptoms visible?
The first 4.5 hours are crucial. That's because very effective treatment might be possible within that time frame. If you think something is wrong, rush to the hospital. There's no time to waste.
Dr. Sasaki, is it possible to detect the early warning signs of a stroke?
We focus on 3 general areas: the face, the hands or arms, and speech. Let's look at the face. Could you smile, Erica? Good. Usually we can smile evenly like that. But if one side of the face becomes paralyzed, then only the other side will move. That's an early sign of a stroke. Also, as one side of the face stretches like this, the groove under your nose is pulled to that side. As a result, your smile becomes crooked. Next, the arms. Could you please raise your arms like this and close your eyes? Good. You have no difficulty holding them up. But in people with paralysis, the impaired arm will drop and gradually turn inwards. The muscle here tries to hold the arm up, so the arm winds up drifting to the side. That's also a sign of a stroke. Third, speech. If you feel you're speaking differently than usual, you have to suspect a stroke. For example, when you try to say something like apple, but the word doesn't come out smoothly, without a doubt, something serious is going on. I talked about the 3 signs, the face, arms, and speech. But if you exhibit even one of them, there's a 70% chance that you're having a stroke.
Other signs of a stroke include abnormal vision. If the brain is damaged, some people experience the loss of half the visual field when they close one of their eyes, and the loss occurs no matter which eye is closed.
This happens because they've lost vision in the left side of the visual field in both eyes. Some people don't take it seriously. They tend to think their eyesight has deteriorated and they might have to visit an eye doctor. But it's a typical symptom of a stroke, so you should go straight to the hospital.
Next, we'll look at how to assist with rehabilitation at home. Stroke patients need to continue rehab, otherwise their joints and muscles can become stiff or completely immobile. We asked a stroke patient with paralysis in the left side of her body to help out.
First, an exercise for the shoulders. They're very susceptible to damage, so you have to be really careful. Usually, we might raise someone's arm like this, but that's not good for the shoulders. The important thing is to keep the palm facing upward. So, when you help someone, put your hands on their thumb like this. That makes it easy for them to rotate their palm. Next, help them stretch their elbow and raise the arm slowly while keeping it straight.
So we always have to have the palm facing upwards. So what happens, is it just a completely different rotation for the shoulder if we have it palm facing downwards?
Usually you might raise your arm like this with your palm facing downward, but if you raise your arm to the side, the arm stops at a certain point and won't go further. But if you turn your palm upward, the arm can move farther. You can easily tell the difference. So now turn your palm upward.
Yeah, it's different. It's really different. That's interesting. I didn't realize that.
Next, the fingers. When you work with fingers, you should always pay attention to the wrist. Many people try to move stiff fingers like this, but it's a mistake. The muscle that curls the fingers extends up to this point. When the wrist is curled, the muscle is loosened, so you can easily move the fingers. The key is to stretch the fingers further together with the wrist.
So again, it's flexing the wrist right out and stretching the fingers.
That's right. So first, straighten the patient's fingers while the wrist is bent. Then, straighten the wrist like this. And then give the fingers a good stretch. Please make sure you don't hurt yourself while helping with rehab exercises. Avoid uncomfortable positions. You can stay seated if that's comfortable, and it's easier if you are the same height as the other person. Standing could hurt your lower back.
And when is the best time of the day, for example, to do these?
It's easier to loosen the joints when the skin and muscles are warm. So it's best to do these exercises after taking a bath. Doing them frequently is important. So I'd recommend doing them twice a day, in the morning and in the evening.
So it's been really, really interesting today. So thank you both so much for your time today.
Thank you.
ありがとうございます。